Good afternoon, everyone. Thank you, Erin. I'm Dr. Gina Welch. I'm the director of the Nurse Anesthesia program at the University of Michigan-Flint. Thank you all for taking time out of your busy schedule and on this beautiful afternoon to spend some time with us learning a little bit more about the Nurse Anesthesia program at the University of Michigan-Flint. So I'm just going to go ahead and start with the presentation. If you have questions during the presentation, you can just turn your mic on and ask that question, or feel free to put it in the chat or wait until the end during the Q&A session, and we'll get through as many questions as possible. I'm just going to go ahead and stop my video, and I'm going to start sharing my screen for the presentation. All right, so today in this webinar, we're going to talk about highlights of the program, the cohort size and how the cohort moves together through the program, the pass rates, the career of nurse anesthesia, the admission requirements, the steps in applying to the program, and then of course our Q&A sessions. And you'll notice photographs throughout the presentation of our students around and on campus. Many of them are photos of that with our cohort that started fall of 2024. And so this is 4 of our students on one of the bridges on campus taking a silly photo. The DNAP program is the Doctor of Nurse Anesthesia program, and it is the pathway to become a CRNA or a certified registered nurse. And CRNAs are able to provide quality anesthesia care to patients of all ages in all settings. And so within the practice of anesthesia, we have the same scope of practice as a physician anesthesiologist. And our program is ranked among the nation's best. And our cohort size is 30. So 30 new students are admitted each fall, and they move through the program full-time. Didactic coursework is full-time, and then there's a clinical progression that starts part-time and then becomes full-time in the 2nd and 3rd years of the program. And the cohort moves together through the program. So you're in all the same classes and experiencing all the same things at the same time as your classmates in the cohort. And so that really generates a camaraderie and a feeling of connectedness with your cohort, as well as with the program faculty and staff. And that's something we encourage, a very family-oriented, family-like environment that's collegial at a minimum and is very supportive and is constantly focused on student success and wellness. And we moved from the master's level to the doctoral level in 2018. We graduated our first doctoral cohort in 2021, and we will graduate our second one this summer in 2022. And that move was required, and all programs will in Michigan have made the transition, and the remaining programs will make that transition or close in the next year or so, because the last students were admitted prior to January 1st, 2022 that were in master's programs. And then we'll talk about the statistics for the program, including the pass rates. And my dog Lulu is with us today too, so she just wanted to say hello. That's what the barking was. All right, so if you can see here that we have our class of 2021. Our statistics are here for that class, but they're not quite complete. We had a few things go on with the cohort that involved individual student things that were not program related. And so these are somewhat incomplete, but our first time pass rate was above the national average. So you can see it was 86.4%, and 84.1% was the pass rate national average. So we're above that. And we had no attrition from that first cohort. And so we have had a history and a tradition of pass rates well above or above the standard, which is 80%. And our attrition rate has historically been very low, 5% or less. In our last 3 cohorts, you can see, and our students do well on their certification examinations, and they also are known for and have a reputation for graduating and being strong clinicians from the time of graduation when they enter practice. And CRNAs are, again, anesthesia professionals with a very wide scope of practice within the profession, or a full scope of practice. And that practice can be modified or restricted based on institutional rules, state, local, federal law, those types of things. But recently in Michigan, we had a full scope of practice bill pass in the fall, and the opt-out was signed, which was a billing restriction for independent practice by the governor. And so we are able in Michigan to practice as CRNAs within our full scope. And CRNAs practice in every healthcare setting, from office-based to dental anesthesia to inside surgery centers, hospitals, the more traditional settings where you think about a CRNA practicing, also in endoscopy centers, on the battlefield, VA hospitals, and especially you'll see CRNAs practicing battlefield anesthesia independently, as well as in rural settings where there are no other healthcare providers, and there would be no access to many types of care if it were not for CRNAs practicing in those areas. And so we are not only able to practice in any setting in which anesthesia is given, but we are also able to care for patients of all ages throughout the lifespan. And this is just a short video that, I can get it to work. Oh, no. That just, oh, here it is. A little video about what a CRNA does. All right. So to become a CRNA, you first have to be a registered nurse. I'm sure many of you in attendance with us today are registered nurses. So you first become a registered nurse, and you complete your nursing program either as an ADN and associate's degree or as a bachelor's degree. Take your NCLEX exam, become certified as a registered nurse. And then you'll also need a baccalaureate degree in either nursing, so completion, BSN, or another appropriate science degree that meets the prerequisite requirements of the program. And then you also must have at least 1 year of intensive care, critical care, ICU experience. And typically students have on average 2.9 years of experience in the program. And ours is probably within that average too, somewhere in that 2.5 to 3 year range is what we see. But we've had students with more or less experience be successful in the program. So we like a diverse cohort, and always including experience type and length. And our program, the DNAP program at the University of Michigan-Flint, prepares students to enter practice as a CRNA. And we do that by preparing you both clinically and didactically to gain the experience and the knowledge you need to take and successfully pass the national certification exam. And so you have to graduate from an accredited nurse anesthesia program accredited by the council on accreditation for nurse anesthesia educational programs, which we are of course accredited by that body. And programs, again, there are a few master's programs still out there. They're no longer matriculating students or bringing students into their program. They will have to transition or close. So by the time most of you are going to apply, and actually you can't matriculate anymore into a master's program. So doctoral degree is where we're at with bringing students into a program. And of course, we did make that transition a little bit earlier. We were one of the first programs in Michigan to make that transition. So all students that graduate in the next few years will be transitioning to that doctoral program. Just a few more master's programs or graduates out there. And the education and training for CRNAs is obviously intensive, both didactically in our classrooms, in our simulation labs, in our workshops, as well as in the clinical area. And our students get well above the average in clinical experience case numbers. And that's something that we really focus on. And that's how we're able to produce such strong clinicians as they enter practice and transition from the role of a student to an autonomously practicing CRNA. Our program is 46 courses, 92 credits. It's completed over the 3 years. It's a cohort-based program, and all students receive a detailed plan of study, and it's the same for all students within the cohort. So again, you move through the program together as a cohort. In the first semester, there's 1 day of class, and there are a few other in-person things associated with the program that semester. The second semester, it's a 3-day commitment, 2 days of class, and 1 day of clinical prep activity. So there are workshops, there's shadowing, there's simulation. There's a variety of things in the second semester that we do to help prepare you and transition you from the front-loaded portion of our didactic program into the full didactic and clinical integrated portion of the program. And then in third semester, it's 1 day of class and 2 days of clinicals. And then when you start second semester going beyond, it's a full time commitment. So 1 day of class and 4 days of clinical. Here's a list of our clinical sites, and we are adding more clinical sites all the time to this list. We just added 2 additional clinical sites in Novi and Southfield in the last week. And we have several other sites that we are in process and will be adding in the next 6 months. This allows our students to get a wide variety of experiences throughout the state. And this is a wonderful way for students to really learn from many clinicians and see the varied practice from site to site. It also allows students to find a site or find the type of practice that most appeals to them as they transition again from the student role into the CRNA role. Many of our sites are CRNA only, CRNA solo practice sites. So students all get an experience doing that. And we are the only nurse anesthesia program in the state that has clinical placements at Michigan Medicine. And those placements include University Hospital, the main hospital on the Michigan Medicine campus, as well as CS Mott Children's Hospital, Kellogg Eye Center, East Ann Arbor Surgery Center, and Brighton Surgery Center most recently. So how do you get into a nurse anesthesia program or into ours specifically? What's the application process look like? Well, there's prerequisite or academic requirements as well as professional requirements. For us, the academic requirements include our prerequisite courses and a GPA of at least 3.0 in a regionally accredited institution for each of the prerequisite courses is required. So there's a math course, and you'll see that there's a course here listed. Those are the U of M equivalents. You don't have to have the U of M course, U of M-Flint course. You can look at the equivalency database, or you can send your transcripts to Lisa, and she would be happy to review those to ensure that they meet the course equivalency. But you definitely need college algebra or higher, and you can meet that requirement by having taken an algebra or higher course in college, successful completion of the AP algebra or higher. For myself, I took AP calculus, and that was able to meet the math requirement. You can also take the algebra CLEP exam, or if you have taken the GRE is not required for application to the program. But if you have taken the GRE and you scored above the 30th percentile, then we'll take that as a substitution for your math requirement. You also have to have had a statistics class general chemistry, organic or biochemistry, pathophysiology, and anatomy and physiology. And if you've taken organic or biochemistry or A&P more than 10 years prior to the time of application, you'll need to retake those classes to apply for the program. And the prerequisite courses and the minimum grade point average and the retake of the organic chemistry, biochemistry, and anatomy and physiology, these requirements are in place to ensure that our students make a smooth transition academically into the program and that they are most prepared to be successful academically. And it's a very difficult program. It's very challenging, and we want to ensure our students will be successful. And so we want to set all of our students up for success, and that's why these requirements are in place. And if you have a single outstanding prerequisite requirement, you can apply to the program and we will consider you. And if you were to be selected for the program, your admission would be conditional on completing that last prerequisite with an appropriate grade of a B or better or 3.0 or better. Professional criteria, again, this is in place as well. It goes hand in hand with the prerequisite requirements as indicators of preparedness for success in a program like this. It's a very expensive program and it takes a great deal of time. So we want to ensure everyone is well positioned for success. So you need to have a current unrestricted license to practice as a registered nurse in Michigan or another state in the US, or it's one of its proctorates. So you are able and eligible to get a Michigan nursing license. And you would have to have that, of course, before you entered clinical practice in Michigan. You have to have a bachelor's degree in nursing or appropriate biological science from a regionally accredited institution, a nursing grade point average of at least 3.0 from a regionally accredited institution, and a GPA of at least 3.0 from a regionally accredited institution for each of the required prerequisite courses. So not just an overall GPA of at least 3.0, but actually in each course. And again, these are indicators that you're prepared to transition into this type of very challenging doctoral coursework. And you must have 1 year minimum experience working as a registered nurse in critical care. And this requirement is a requirement of our accreditation body. So their way that they define that is that you have working knowledge of mechanical ventilation, invasive hemodynamic monitors, and you're proficient in vasopressor titration. You also need to be currently working in a critical care unit. Again, this is something that helps you transition and be ready for that entry into the clinical phase of your education and training. And so having had that current experience at the time you apply and transitioning with that very current experience is going to make it so that you're most prepared. Some students don't work for their first 2 semesters, some choose to continue to work. But if you've had that recent ICU experience and that good solid base of critical care experience, you're going to make a nice smooth transition into clinical practice. You also need to have at least 8 hours of CRNA shadowing within 12 months of application, BLS, ACLS, and PALS certification. And any other type of certification is going to help improve your application. So your CCRN, your sub-CCRN certifications, the CMC, the CSC, TNC, etc. Those things will help strengthen your application. We look at our applications from a holistic view. So of course we look at your requirements, your grade point average, those indicators of success, but we also look at leadership experience, volunteerism, professional organization involvement, leadership in your unit and in your institution. Those types of things as well will strengthen your application. And I think I talked a little bit about that. So we need detailed descriptions in the supplemental application, and that will give you the opportunity. We have a supplemental application that goes with a regular application to the university that will allow you an opportunity to tell us about yourself and those leadership experiences, organizational involvement, etc. So when you apply to the university, you're going to submit the application for graduate admissions, the $50 fee, which by attending this webinar, you'll get the waiver for that, the supplemental application, the shadowing form, your GRE scores, if you have them, again, not required, but if you have them, you're welcome to submit them in place of the college algebra to meet the college algebra requirement. If you scored in the 30th percentile or above the 30th percentile, official transcripts from all colleges and universities you've attended. If you've previously attended the University of Michigan-Flint, you're not required to submit your transcripts for the University of Michigan-Flint. They'll be transferred to the graduate office, to graduate programs when you apply. An autobiographical essay, and then a copy of your military discharge if applicable. We also need your RN license, your BLS, ACLS, and PALS certifications, and then 3 letters of recommendation. We need one from your nursing program, either the dean, director, or a faculty member of your nursing program. If you're not in touch with anyone in your nursing program anymore, this is a request you can make from the dean's office, and it's a very typical request for the dean's office, and they should be able to promptly give you a letter of recommendation. Also, one from your present employer or supervisor. If you work in a unit that is very strict about how and when they will write a recommendation letter for you, please reach out to Lisa. She is happy to guide you through the alternatives if that's the case. And then also from a practicing colleague who's familiar with your work as a registered nurse. International students have additional requirements, and the international student page on the University of Michigan website. University of Michigan-Flint website will provide you all the details you need. And you can always reach out to Lisa or to grad programs, and we're happy to help guide you. And then once we have all the application materials and completed applications are sent to us, the application deadline is September 1st for early admissions and February 1st for regular admissions. All the completed applications are sent to us as long as everything is in by the deadline. If you think you're going to be ready for early admissions and then you're not, it automatically will get pushed to regular admissions for us if you're missing some documentation or items at the September 1st due date. And once we get all of the applications, they're reviewed, they're scored, and then we determine the number of interviews that we're going to conduct for that phase of the application or the application cycle or the admission cycle. And we typically will interview between 30 and 35 students in early admissions and the same number in regular admissions, and we take 30. So we typically interview 60 to 70 for the 30 seats. And then once we have selected the candidates that will be interviewed, they're notified, they schedule an interview. Typically for early admissions, we interview in October or November, and regular admissions in March. And then we conduct those interviews virtually. And our program, again, admits one cohort annually each fall. And to be considered for admission, we need all of your application materials in by the deadline. This is the tuition rate for the 2021-22 application cycle, or I'm sorry, academic year. And this will change, and the new rates will be posted shortly. They were just recently approved by the regents, so they'll be updated shortly on the University of Michigan-Flint website. And you can also follow the program on its Facebook page. We I like to post lots of pictures of the students. These pictures here, there are students, our class of 2021. On the left-hand side, that was when they just started the program and they were getting a tour at Hurley Medical Center. Very happy, smiling faces. And then you can see even happier on the day of their graduation on the right. So that was their actual final day in the program and just after their graduation ceremony. So. And if you have any questions, please feel free to reach out to the grad program office, especially if there are questions about the application process or navigating through the application process. They're very happy to answer any questions you have. Extremely helpful staff in that office. And then if you have questions specific for the anesthesia program, please feel free to reach out to Lisa. She will help advise you, and she advises our applicants prior to them coming into the program and during that application process. So if you have questions about your transcripts or you have a specific question to your situation, please feel free to reach out to Lisa. If she's unable to answer the question, she will reach out to me and we'll get your question answered for you promptly. And this is our class of 2024 in their orientation last fall, and they're getting ready to transition. They're in their first clinical rotation right now in their first semester in clinical, and they're getting ready to transition this fall into their second year in the program. All right, so I'm going to stop sharing and I'm going to restart my video and answer any questions you might have.
Okay, I have a question.
Okay, Kayla, go ahead.
Okay, so I haven't seen a program where they do like an early interview or like an early admission versus the normal admission time, like in February. So I guess if you got your application information in by the September 1st and you do your interviews in the October-November time, do you still not hear whether you're accepted until after the regular interviews in March?
That's a great question. And that is a unique thing to our program, that we do the split admissions within the same cycle. You will hear something from us if you interview for sure in the fall. So what the three options that will occur is if you apply for early admissions, you will either get an interview or be deferred to regular admissions. That's the first step. If you get an interview and we do the interview, conduct the interview, you will either be denied a seat at that time, you will be deferred to regular admissions, or you'll be offered a seat.
Okay, so there is a slight like benefit to doing the early admission because you have the chance of getting in earlier or being deferred to the regular.
I don't know if there's a benefit, but it's not negative to apply early, even if you're deferred.
Okay, perfect. That's what I was really wanting to know. Okay.
Yeah. I mean, you're welcome. If you're ready for early admissions, by all means, please apply. But I think the regular admissions, half of it, most programs, their full admission cycle is in the fall. So the benefit of our regular admission cycle is people that weren't ready in the fall that are then ready in that winter semester. You know, they just need that one additional semester to get ready. They are able to then apply for that next fall rather than having to wait a whole nother year.
Yes, perfect. I love it. Yeah. Thank you.
You're welcome.
There was a question in the chat, Dr. Welch. Are students typically able to work per diem in the first year of the program?
That's also a great question, Ashley. It's very individualized for each student. It's structured so that you can work and you may work if you're able to balance your work and your didactic load. And some students find it very easy to do that. Some find it to be very challenging. And there's really it's very individual. We'll have students that have, a couple of children and they have a very busy life with their family, and they're able to balance that with work, with school. And then we'll have students that are single, living with their parents and it's just too much to work and go to school. So it's really, really very individualized, and we support students either way. And I think some students just really want to prioritize this and don't want to have to work at the same time. So it's really individualized, but students are certainly able to work, or it's designed for students to be able to work in the first year. However, if there is any issue with your didactic performance, one of the first things that our faculty are going to counsel you on is taking a step back from work and cutting back on your work hours to help you adjust and be successful academically. And we always suggest that you transition from whatever your FT is prior to being in the program to a per diem or locum situation, so that you are very able to control your schedule and adjust your hours as necessary to really prioritize your education and your role as a student in the program.
Thank you, Dr. Welch.
Yeah, of course.
Okay, do you want me to read these to you, or do you want
I can read them. That's okay. Okay, the next question is, how many people typically get deferred during early admission? It depends on how many students apply or how many applicants we have for that portion of the cycle. So the only way you would hear from us that we're not going to consider you for regular admissions is if you don't qualify. If you don't qualify because something's missing, or you don't have the minimum GPA, or there's some other issue with the application, that's the only time we wouldn't defer. So if you don't get an interview during early admissions, you'll be deferred to regular admissions. And again, that varies depending on, and I would say we typically get about half and half. So maybe 60 students is probably, or 60 applicants is typically how many get deferred. It's a very competitive process. We get a lot of applicants for the seats, so, which is typical for nurse anesthesia programs.
Thank you.
Of course. The next question is, how do you support students in capstone projects? So our scholarly projects are very heavily mentored by our faculty, and they're very heavily mentored by our faculty. Our faculty take a very active role in our students' research projects and really mentor and support them from the time that they're initiated. And they're actually initiated in the third semester of the program. And that support starts in the third semester as the basic parts of the manuscript are written through the entire process. So it's very, very, the mentorship through the research project is one of our focuses in the program, certainly. Okay. The next question, has the anesthesia market ever been saturated, and what does that look for the next 5 years? Well, if it's been saturated, it has not been saturated since the time I've been in healthcare. So I've been a nurse since 2008, and I've been a nurse anesthetist since 2012. So there is no saturation, and there's actually a high demand for anesthesia professionals, both anesthesiologists and nurse anesthetists. So that outlook is very good. Our students have multiple offers every year. And some of them we're seeing stipends and some things that we haven't seen in a while. So there's a high demand for nurse anesthesia providers, for all anesthesia providers and for nurse anesthesia providers, both in our state and in other areas throughout the United States. Okay. For in-state tuition, how long do you need to be a resident? I currently live out of state, but would most likely be moving to Michigan while in the program. Erin, do you know the answer to that? Did we lose Erin?
She just messaged me. Her internet crashed.
Oh no. I'm gonna wait on Erin's return for the answer to that question. I think you have to petition the university to move from out of state to in-state. So, but Erin will be the best person to answer that question. So when she returns, we'll ask that one again. Thank you for that question. That's a great question, and I'm sure if anyone else is from out of state, they're wondering the same thing, because there's a big difference in and out of state tuition, obviously. The next question is, how do we improve nursing GPA? That's a good question. It depends on how the nursing program is structured. It may be very difficult to improve your nursing GPA. You have to be in a nursing program to take nursing courses. So if they were courses, if your nursing GPA is low because of a course within that, it's going to be difficult to resolve it. And so we look at by nursing GPA, we look at the entry to practice nursing GPA. So the GPA for the degree that you entered practice as a registered nurse. So if you became a nurse as an ADN and you then got your BSN completion, we look at your ADN nursing GPA, not your completion BSN. So because that was the more rigorous program, the entry to practice nursing program is the one that's going to be the most rigorous and the one that's most indicative of your ability to be academically successful in this type of program. So that's how we look at that. So yes, so that's a question about improving nursing GPA. It might be challenging. You'll have to look at where the deficits are and see if there's an opportunity to retake some of those courses. And if they're not nursing specific, that may be an opportunity there. But retaking courses is typically how you're going to improve a GPA. The 3.0 is the minimum, especially with the science courses. Retaking anything that's below a 3.5 is really going to strengthen your application. And then this kind of leads into the next question. What's a competitive GPA? And is the GPA that's counted only from courses from our nursing degree, or would other courses count as well that aren't related? So your overall nursing GPA is not just your nursing courses, but it's the GPA that you graduated, again, for entry to practice nursing. So it's your ADN or your BSN, depending on how you entered practice as a registered nurse. And then again, a competitive GPA, I mean, we see a range, but I would say our average GPA is typically 3.5 to 3.7 overall for our sciences specifically. Okay. With the recent healthcare bill changes related to CRNA supervision in Michigan, will hospitals be more likely to steer away from ATC model in the bigger hospitals? I don't think we'll ever see full removal of the ATC model in the big hospitals because of the way an ATC model, when it works well, and there's the roles and the way the anesthesia care team works together. I think we might see some optimization of how that model is executed, but I don't think that we'll see a full removal or I think there's still going to be space in the large hospitals for anesthesiologists. But we might see QZ billing, which is CRNA only practice within that institution. So places like some of the offsite locations like GI lab, some of the non-operating room area like MRI, there's definitely room to see independent practice within the larger hospitals, even in those that practice within anesthesia care team model. How well are your graduates for being thrown into independent practice? Well, our students, many of them go into independent practice when they graduate. They choose that type of practice and they're very successful. We've had students from both our master's cohorts and our doctoral cohorts. And we have a student in this current cohort that will be going into an independent practice situation. So they get a lot of exposure and experience at those places. And they, like to hire our grads and there's opportunities for them to work in those settings. So they're certainly prepared. Okay. Let's say prerequisite GPA is 3.9, ADN GPA is 2.9, and BSN is 3.7. Yeah. So if I'm not sure, we'd have to look more specifically. If you have a specific question, send it to Lisa about improving an ADN GPA. It just depends on the courses in which you had the low GPA. If they're nursing specific courses, it's going to be difficult to improve that GPA. And you can certainly take more advanced courses, but you have to meet the minimum requirements. We have to have the admissions process and criteria needs to be standard. Okay. As we've seen in the healthcare field, healthcare providers are experiencing a significant increase in burnout. Do you see CRNAs experiencing burnout? I think that I've seen a lot less burnout than what I've heard about in the ICU field secondary to COVID, if that's specifically what you're asking about. And we've done some research in the program about that. I think a lot of people experience a lot of increased stress, not always related to work. I myself was working at Hurley Medical Center where I practiced as a CRNA during the pandemic. And we certainly saw some things that were challenging and impactful, but we were really insulated from a lot of the things happening. You know, we were still taking care of patients primarily in the operating room. And even when we went to the ICU to intubate a patient, we knew, especially at the beginning, that it was very unlikely that the patient would come off the ventilator, but that was the extent of our care for that patient. So I don't think that they're experiencing burnout to the same degree, but we understand that the role of a CRNA within the healthcare field and all of our students coming in have experienced significant stress and strain as RNs at the bedside, especially in the ICU, and also as students that the stress levels are high. And so we have a focus on wellness and student wellness and success. And we have programming surrounding that. Okay. What can be expected from the interview process? What's the best way to prepare? Our interview process isn't a stress interview. It's just an interview structured to allow us to get to know you, to allow you to get to know us a little bit better, and to see if it's a good fit. Fit is very important in graduate education. And so it's really all about fit and determining if it is a best fit for us and for you. The first part of the interview is spending time with some of our current students that you get to ask them questions and pick their brains a little bit. And also, it's a little bit of an icebreaker for you to help you relax and get comfortable in the interview process. And also, if there are any bugs with the technology, you can get them worked out in that first piece instead of right before you come in and talk to the faculty. So we found that that's very successful and works well. We also have continued the virtual interviews. Obviously, we were forced to do it with COVID, but we've continued it because we think that it really increases the equity and inclusion of our interview and admission process. And so that's why we've continued it post-COVID. When you say that specialty certifications make your application stronger, is it worth it to obtain multiple? Yes, it certainly is. So, but also if you are have some other type of, like if you're an EMT or a paramedic, that will count as well. So, okay. So if I took government history and psych classes in a previous state and had them as prerequisites for a nursing program, but then moved to Michigan where they aren't required and aren't in degree plan, what counts as, the way we figure your nursing GPA is where on your transcript it says degree granted, ADN, BSN, for your entry to practice. The grade point average that's right next to it, that's the one we use for your nursing GPA. And if you're not sure, Lisa will be happy to look at your transcript and help you figure that out. But that's exactly how we figured out. We don't calculate it. We don't dig around through transcripts. We literally take the GPA that was obtained with your entry to practice nursing degree. Okay. What are some ideas for increasing leadership and organizational involvement as a travel nurse? Since I've left the bedside, I haven't been involved in charge nurse, code teams, or preceptor. I've been involved in AACN meetings, classes, planning to attend the yearly AANA. Do you have any recommendations on how to improve? I mean, the professional organization stuff, it sounds like you have covered. If there are ways to get involved in the community that you're in as a travel nurse, especially if you're in that community for a length of time. You can always get involved in community organizations and volunteerism that will help strengthen your application. But I know sometimes in the facility, it's a bit limited when you're a travel nurse, certainly. Do you have anything that specifically stands out or anything specific that you suggest to doing that stands out on an application? Again, the leadership, the volunteerism, the professional organization involvement, certifications, retaking courses that you perhaps don't have a high GPA in, those types of things are going to stand out to us. There is a exam portion, yes, and that is, it's like a CCRN style exam. Just curious, have any of your students pursued a COA accredited fellowship? I don't think the one at Children's Hospital is accredited. I don't know if those are, I'd have to look. But certainly they could. You don't really need to have a fellowship as a CRNA. So most people want to go from being a student to maximizing and getting back to having an income. And sometimes those fellowships pay at a lower rate. So there's not really a ton of interest in those fellowships for CRNAs. Where I see CRNAs typically pursuing those types of fellowships, one, they'll do it if they want to get a job at a place like Children's Hospital of Michigan. It's required for a new grad. So you might see it there. The other place you might see it is CRNAs that are interested in pain. They'll go and get their certification, and they typically do that several years out. But our students certainly would be able to do that if they wished. Is there a mock code during the interview process? There is not. Does internship time in the SICU or ICU count toward this time requirement? It does not. It has to be time practicing as a registered nurse at the bedside, and it's got to be full time. So if you work part time, let's say, like you work, 0.5 FTE, you'd need 2 years of 0.5 FTE. So it's 1 year full time at the bedside as an RN in critical care. All right. And Erin, there was a question for you.
About residency?
Yes.
Yes, I saw that before I got disconnected. I apologize. So the general rule with residency is you have to have resided or worked within the state of Michigan for 3 years at the time of application. So that's what we do the initial residency classification based on. Now, that isn't a firm classification. What it means is essentially if you want to apply for residency further, you would simply work with the residency office, which is in Ann Arbor. So you could apply for residency online. They often would ask for things like taxes, W-2s, or utility bills. And those are things that you could use to prove residency. So that's we just make that initial classification based on 3 years. That's how we do it.
Thank you, Erin. Okay. Is NICU and PICU considered an ICU nursing experience? Yes, but you have to be able to demonstrate that your experience is qualified with, as far as ventilator management, as far as vasopressin drips, vasoactive drips, and management of other types of invasive monitoring device modalities. So, like, for example, if you work in a PICU that is a pediatric cardiothoracic ICU, like at Children's Hospital or at Mott in Ann Arbor, those types of experiences are going to be excellent and you're going to be well prepared to make the transition to clinical practice as student registered nurse anesthetist. So it depends on the unit. So some yes, some would qualify, some would not, depending on what the situation is on that particular unit, the type of experience and the type of patients, and obviously much of that is going to depend on the type of hospital. So, and sort of leading into that, do you have to have level 1 trauma experience, or is some of you probably work at level 2 facilities? That's completely fine, but that is a factor that we consider when your application is scored. We do not have a preference on ICU type. All ICUs can be valuable. Again, it's how the quality of your experience is going to depend on the types of patients you care for, monitoring modalities, how stable or unstable those patients are, what types of devices you've been exposed to, et cetera, those types of things. I don't know that we've seen an increase in applicants since the pandemic, or if I don't think it's related to the nurse anesthesia programs are always quite popular. So, but we usually have a strong applicant pool, and we're seeing increases in the strength of our applicant pool. Students are allowed to rank their location preferences for clinical site rotations, but there are many factors that go into assigning clinical rotations, and some of those are based on experience requirements. We have to ensure that you've got all the required experiences and you have adequate experience in each area to be able to graduate, sit for your NCE, and be able to transition into CRNA practice. So we certainly do take into account the students' preferences, but there are always many factors that go into it other than just preference when assigning clinical site rotations.
It is approaching 5 o'clock. Does anyone have any last questions they would like to ask Dr. Welch?
Hi, Dr. Welch. I have a quick question.
Hi, Matt.
Hey, how are you? So are there at any of the clinical sites, do we compete with any other student nurse anesthetists or any residents for cases?
There are sites that we have that are shared with other CRNA programs, and there are some sites that have residents. But typically the sites, especially that have residents, are very large, like Michigan Medicine. And there's probably over 80 sites of service at Michigan Medicine a day. So, and I think there's, like 15 residents. So that's just an estimate, but you're not going to compete there. It's such a large place. Some of the sites that are a little smaller that have sRNAs from multiple places, they work to ensure that they optimize the opportunities for students from all the programs. And all of the programs in Michigan really are very collegial, and the program directors, we all talk to each other. We have 5 really great programs in the state. So we work cooperatively to ensure that all the students are going to get the experiences they need.
Awesome. Perfect. Thank you so much.
You're welcome.
Any other questions before we end? All right. Well, we thank you all for your time today. Like I said when we started, I will send you the waiver code tomorrow so that you can enter it in on your application. And I will also send you a copy of this recording. So thank you for joining us today. We hope to see your application soon.
Thank you again, everyone.